I'm Dr. Narasimhaiah Srinivasaiah, a senior consultant, colorectal, pelvic and peritoneal oncological surgeon. I'm based at Apollo Hospitals, Bengaluru. I'm also the head of colorectal services for a Karnataka region. I hold a honorary senior lecturer job at Queen Mary University of London. I would like to spend the next couple of minutes talking about why there is a need for subspecialization within the spectrum of general surgery. Things are changing. There is increasing complexity within the disease processes as well as advancing knowledge and skill. We also know that people who undertake subspecialty organ-oriented practice have better surgical outcomes, both in the cancer setup as well as the benign setup. Think about neurology a few years ago, pulmonology a few years ago. So things have only subspecialized and change is the only constant I see. So for the better care we have to provide to our patients, standardization of procedures, to keep up with the current evidence-based practice, skill and expertise, I think subspecialty is the need of the hour. What we do not realize is the gut, the GI tract, is one of the huge organs. And there's a lot that happens within the GI tract. When we are concentrating on the colorectal specialty, we are looking at the colonic pathologies, the appendicular pathologies, the rectal pathologies, anal pathologies, the pelvic pathologies, as well as the peritoneal pathologies. It could be as simple as diverticulosis to tuberculosis, colitis, it could be infection, inflammation, or it could be cancers related to appendix, colon, rectum, or even the anal canal. Polyps are a part of the process, and polyps are also dealt within the subspecialty of colorectal surgery. In addition to the cancer work we do, we not only deal with the localized early cancers, but also deal with locally advanced cancers of the colon and the rectum, either primary or recurrent cancers which come after an initial operation. They could involve not only the bowel but also the bladder as well as the uterus in the female population and prostates in men. When such is the case, one has to go for an advanced surgery called as pelvic exenteration, which is also under the remit of services we offer. For low volume metastasis within the peritoneal cavity, either as a result of appendiceal cancers or pseudomyxoma peritoni or colorectal cancers with low volume load within the abdomen, we can undertake cytoreductive surgery and HIPEC therapy, which is also under the spectrum of services we offer. Apart from the malignant services, we also offer diagnostic services for bowel abnormalities, screening, and we attend to the huge spectrum of benign diseases as mentioned, such as Crohn's, ulcerative colitis, tuberculosis, diverticulosis. In addition to that, a big spectrum of pelvic floor pathologies such as constipation, difficulty evacuating, fecal incontinence, fistulae as a consequence of obstetric injuries, and proctology, which includes hemorrhoids, fissures, complex fistulae, etc. There are three aspects to it. I think from a clinician's perspective, the colorectal specialty was looked after by the general surgeons for a while. The surgical oncologists were also looking after it. And now subspecialty surgeons have come with colorectal surgery who are also trying to achieve colorectal surgery to bring as a separate subspecialty. So the cases are essentially spread amongst a number of surgical clinicians. In a way, I would see this as a benefit rather than a harm until unless one attends to and concentrate on that specialty and moves forward. So to streamline the case, to standardize the care we offer, to bring in guidelines and policies that are important, and also to have that quality assurance both in the diagnostics as well as the surgery is important. I think that is a challenge from the clinician's perspective. Two, from a patient's perspective, I think we still have a bit of an hesitation to come forth with the symptoms and the signs and ask for help. I think that is something we need to attend to by creating awareness amongst the general population and informing them if caught early, cancers can be cured. This is the second challenge I see. The third challenge I see is with the system, the policy makers, the government, who should come forward and create some guidelines and policies and try and see if we need a screening program for colorectal cancers or GI cancers per se. That is something the government has to work on. To start with, gather the data and then see if a screening program is necessary or is essential. They should do something like what they have done for the head and neck cancers. So much of awareness has been created for head and neck cancers, for cervical cancers. The same has to be translated to GI cancers and colorectal cancers, I think. So I think these are the three challenges that needs to be attended to. I think Apollo hospitals are at the forefront of oncological, surgical, medical and radiological managements. They have a setup which includes all the facilities and they have clinicians of all specialties under one roof. Apollo is one of the first centers to have PET CTs. Now, they are the first to have a proton beam therapy in Chennai. They have the best oncologists, best radiotherapists and best surgeons available. It's not only the physicians, the surgeons, the system is well tuned for cancer care. We have the best available up to date in the whole world. In addition to that, we also utilize other tools in the decision making process. Our tumor board process for all the cancers is very robust. We have a regional tumor board and a national tumor board. In addition, we also use artificial intelligence such as IBM Watson to help us with the decision making process. So we do use a number of tools available and also technology, whether it is laparoscopy, whether it's single incision laparoscopic surgery, whether it's robotics, it is all out there available to us to undertake a minimally invasive surgery or an excentrative surgery as the situation dictates. So I do think we are at the forefront of cancer care in India.